In order to get more insights how community health workers can contribute to improve postpartum family planning, we conducted qualitative study using a case study approach to understand how community health interventions are shaped by health system context, along with identifying intended and unintended outcomes. We conducted in-depth interviews in Kiswahili, and they were transcribed and translated in English. And we conducted thematic analysis using NVivo software. We also conducted interviews with 5 national level officials, 5 regional and council officials. We also interviewed 4 CHW supervisors. These are facility-based providers. And we conducted 16 interviews with CHW, whom 8 were interviewed twice as a follow-up. And we also conducted interviews with 20 young mothers and 3 implementing partner staff members. So in 2023, we had 22 interviews. In 2024, we also had follow-up interviews. And we also conducted 2 participatory analysis workshops, which informed the revision of our themes. We triangulate our findings in different sources, and we also updated our program theory. So what did we find in our qualitative evaluation? We found out that CHW face inconsistent support in terms of training, mentorship, and financial incentives. So across the CHWs that we are working with, they had a number of different support from different projects, which leads to CHW being pulled in different directions without proper guidance and prioritization. But also CHWs are very essential to healthcare delivery, but they are heavily reliant on donor-funded projects. And that support often ends when the project closes or phase up, which leaves a gap. But also there are inadequate financial support to support CHWs. So in terms of their career growth, but also stabilizing their roles at the community level. We also identified that local leaders, they have very important roles in operationalizing priorities and hold resources that can be deployed in support of quality health services, or they can also hinder CHW access to the community. And we also identified that these leaders have local knowledge and local knowledge of needs and the assets in their communities. Yet policy directions are often top-down process and are just passed down for local leaders to have approval for implementation. But we also noted that activities like supportive supervisions, mentorship, and trainings to CHWs really improve their performance in doing counseling and also distribution of family planning at the community level. But an amazing thing that we have also noted, despite them being facing a lot of challenges in terms of low payment and inconsistent support, they have that strong sense of duty to their communities. They are very committed and they are passionate about their community to save their communities and ensure that their community is healthy. And on sustainability, we had a challenge of different conceptualization of the concept of sustainability. For CHW, sustainability for them is to sustain what is existing on the ground. But for decision makers, sustainability is often influenced by allocation of availability of resources to scale up beyond the donor-funded. And we also encountered institutionalization barriers which require resources, making sure that the programs are embedded in the policies. So our conclusion is that our findings demonstrate that CHWs are perceived by decision makers as an integral part of health care delivery, and their role aligned with the government priorities. Yet coverage and support to this cadre is fragmented and unsystematic. But also CHWs are faced by weak coordination mechanisms, such as supportive supervision and recognition, which set as a barrier for them to implement at the community level. And our findings that strongly support the current government initiatives to standardize and formalize CHW cadre. We recommend the shift of volunteer model towards salarized CHW cadre, which will be accompanied by supportive supervision, strong referral mechanisms, and improved community health quality and coverage. We really acknowledge the support from Bill and Melinda Gates Foundation, but also the Ministry of Health, PRAG, RCHMT, our implementing partner, TAHEA, George Washington University, Save the Children US, and Save the Children Tanzania.